To the lectern right now to give us an update on the coronavirus pandemic.
Almost 16,000 tests throughout the Commonwealth, bringing our total to over 315,000 tests. Sunday's test numbers were the highest number of tests we've ever processed in a single day since the pandemic began. As we all know, ramping up testing capabilities continues to be one of our highest priorities, and it's incredibly important to the success of our community tracing program, both of which will have a lot to do with the new normal once we get there. It's good to see the total test numbers continue to increase, and I think as we talked last week, we added 18 community health centers around the Commonwealth and key locations to our testing community to make sure that we would continue to test in places where people felt we had significant concerns. There were 1,824 new confirmed COVID-19 tests in that batch of tests, which means about 12% of the tests that were conducted were positive. In the last 7 days, positive test rates have come in under 20% every day. Seeing only 12% positive rate with this round of testing obviously continues that trend. We continue to hold daily calls with our colleagues in the healthcare community to closely monitor hospital capacity, hospitalization rates for COVID, and ICU bed days for COVID, as well as ICU rates generally. As of yesterday, 3,617 patients were hospitalized due to COVID. This represents about 5% of the cases in the Commonwealth. COVID hospitalizations have actually been decreasing in the past several days, with very few spikes in new admissions. The number of patients dealing with COVID in the ICU has also dropped to under 1,000 to 904 patients. There are obviously still thousands of people who are being hospitalized due to this virus, but the numbers have started to trend in the right direction. It's also important to note that different parts of Massachusetts are in different stages at this point in time with respect to the pandemic. For example, COVID hospitalizations and ICU bed days related to COVID have gone down in Western Mass and on the Cape, but remain high in Worcester and on the South Coast and flat in Boston. That said, we have had some positive evidence with respect to people returning to the hospitals and to the healthcare system generally who are dealing with chronic and other medical conditions that have nothing to do with COVID. This is a really good thing, and that's a trend we hope continues. And as we've said before many times, if you are in fact dealing with a chronic condition, if you do believe you're sick, you should continue to engage or begin to engage with your clinician and your doctor. And if you feel very sick, you should go to the ED. The system is there. People can treat you. The capacity exists. And we don't want people putting off necessary medical procedures because they're concerned about the system's ability to serve them due to COVID-19. The simple truth of the matter is that is not the case, and most of the hospitals in Massachusetts are serving far more people for reasons other than COVID than serving the COVID population. We built it that way. We organized it that way. We want people to continue to access the system if they need to. We've also had tremendous success with our telehealth program. You can always reach out to your clinician by phone or through some sort of video chat. That is a covered benefit in Massachusetts, and hundreds of thousands of those kinds of visits have taken place over the course of the last 40 days. People should continue to use that if they need to reach out. Frontline medical workers continue to be, in many respects, terrific performers in all of this. And as we talk to hospitals, we've been pleased to hear that for many of them, they're down to the lowest number of workers they've had out due to COVID since March, I think was what we heard on that call this morning. And with everybody else playing their role, and by staying home, doctors and nurses have been able to do the job they need to do, taking care of their sickest patients. We continue to chase down personal protective equipment to ensure the safety of our frontline healthcare workers, our nursing home workers, our emergency responders, vulnerable residents, and others. Over the weekend, we joined with the other northeastern states in a united front around procuring PPE on a go-forward basis in a more organized fashion so that we can maximize our orders and bring in quantities that we'll need for healthcare workers, public safety people, and others as we go forward. And as of yesterday, we've delivered over 8 million pieces of PPE, including masks, gowns, gloves, and ventilators.